Now, experts say the most definitive way for us to get out of a perpetual state of a lockdown is accessing the COVID-19 vaccine, or one of the various vaccines that do exist. But vaccines aren't cheap. South Africa, with most of the developing world, is already in the back of the queue waiting for the vaccines, while countries like the United States, the UK, Norway and Australia have already started vaccinating campaigns across the country, having vaccinated millions of their citizens. Meanwhile, Canada has procured enough vaccine doses to vaccinate its entire population 5 times over. This raises questions about whether this is fair and equitable. Now, joining us to have this conversation is Dr. Tlaleng Mofokeng, a medical doctor and women's rights activist, but was also the United Nations Special Rapporteur on Health. Tlaleng, thank you so much for your time and welcome to the show. I'll ask you this. Canada already has enough doses to vaccinate their population 5 times over, while South Africa does not know how many doses of the vaccine it will get. Early estimates tell us about 2 million doses in the second quarter of 2019. South Africa, along with India, then wrote a letter to the World Health Organization asking, alongside the World Trade Organization, asking for some of the intellectual property rights on some of these vaccines to be lifted so that countries can locally procure and produce these vaccines for themselves, especially where they have the capacity to do so, like we do in South Africa. But the United States, Norway and the UK all vetoed against this and said, no way in hell we're doing that. Does that worry you? And does it worry you specifically what that veto will mean for the access by poorer countries, and particularly poor people in those countries, to the COVID-19 vaccine?
Absolutely. I think it's very important to remember that the issues of availability, access, and affordability of the COVID-19 vaccine is a human rights issue. And in order to mitigate and contain the spread of the pandemic globally, and to support national and international economic and financial recovery, it is imperative that the COVID-19 diagnostics as well as treatment goods, including these vaccines, are fully available, accessible, and affordable to all people who need them. It's also very important, of course, to recognize that India and South Africa did propose certain regulations to the United Nations and to other member states. And it's against this backdrop that as United Nations experts, and myself as the expert on the right to health, that we welcome this movement and actually urge, that other countries, have to support a coordinated response. There has to be assistance in making sure that intellectual property and any knowledge around scientific production and procurement is shared widely across the countries, because we know that this is a human rights issue and in most cases is an issue of life and death.
Now, South Africa is finding itself in a very weird position. We're technically a poor country that can't afford a lot of doses of this vaccine, but according to international financial institutions, and particularly the World Trade Organization, we're too rich to get some sort of charitable breaks on this vaccine. That's to say, we can't get any of these doses for free like most poorer countries will, and India finds itself in that situation as well. Technically, we're missing in the middle. What is to be done for countries in the developing world who are considered too rich to get some sort of discount, but who are still too poor to access the vaccine? Is there a campaign established around coordination for that?
Ideally, there should have been a coordinated effort in this. And I think regionally, it would have made more sense to have different, regions and sub-regions in the world leading in their own scientific research and development and the distribution of this vaccine. But we know also, as the United Special Rapporteurs, we keep stressing on the state's obligations to ensure access to health and essential medicines. And so again, we're talking about, the pressures that low and middle income countries continue to face in terms of obtaining these resources and product, leading to more debt and further reducing their fiscal space for other measures, and other policies for acute health conditions around food and social security. So we know that low and middle income countries such as South Africa and India continue to face added burdens and stresses, again, due to the existing fault lines, structural deficiencies that were existing even before COVID. And it's our call and a reminder to member states that, in fact, these issues are of a human rights nature, of a human rights concern. And many people across the globe, in the civil space, other human rights experts, human rights lawyers, we are all drawing from international human rights standards. And so these are not just a plea on the public good, it's issues of human rights. And we know that more than 56 million people have been confirmed to have COVID-19. And it cannot be that with this disease, as it continues with a new variant, it's even more deadlier than anticipated. We have to carry the cumulative and ensure that we remind ourselves that health is interconnected also with economic, social, and human rights.
Now, the main vaccine that we're sort of all relying on at the moment is the Pfizer-BioNTech vaccine, notwithstanding the Oxford vaccine that was approved yesterday. Now, Pfizer is a company that doesn't have to clean up past itself. You know, the SEC in America, for instance, many years ago had fined Pfizer for price fixing, and Pfizer is commonly known as one of the countries on various other life-saving drugs, for instance, like diabetes, insulin, where Pfizer has pushed the price up all the way to the top, making it unaffordable for most people, even in the developed world. Now, I have a report in front of me that you wrote to the United Nations quite a while ago. This report was made available this morning. And in this report, you asked that pharmaceutical companies should just discharge their responsibilities, including by exercising human rights due diligence to identify and address adverse impacts on the right to life and health, as set out by the guiding principles on business and human rights. Now, that sounds like a lot of platitudes on various statutes that I have no understanding of. What, in your opinion, should happen if companies like Pfizer are once again found to not adhere to what you're exactly asking from them in this report? That's to say, if it is found that they're driving the prices to the top, do you anticipate any sort of litigation against them to drive the price down to the bottom? Because it would be a violation, as you say, of human rights.
Of course, and what you are speaking about, of course, is happening in the context of a lack of coordination globally, but also this global competition that increases prices of medical supplies, and definitely with the COVID vaccine. And like you've made several examples, although I can't speak specifically to different companies directly, but we know as a fact that's how the economy and that's how capitalism works, right? And people who are finding themselves already facing high debt and financial crises are further marginalized, whether you're talking about also people who live in rural and peri-urban centers. Again, globally, if you look at the traditional global south, all of these depend on pharmaceuticals themselves understanding their role as people who are supposed to protect and promote human rights. Human rights are for everybody. They are not a sector issue. They are across the board. Every single industry, every single sector in the world, every single space in the world is supposed to be advanced and guided by human rights principles. And we all, and many countries around the world, have ratified certain, of course, treaties and important resolutions. We can't hold private companies to the same standards and accountability mechanisms we can hold the governments or member states. But what we can do is where people know of human rights abuses or violations, whether they're related to issues of economics, the right to health, the vaccine procurement, the rampant corruption that we've even seen in our own country. There are mechanisms within the United Nations where people can lay independent individual complaints, where you can bring those allegations through to us. And as the experts, we are able to coordinate and ask for more information and write to the different people concerned, whether they are state actors or non-state actors, to ask them to give us more information in order for us to then ensure and safeguard human rights for all. So although our responsibility and our mandate does not fall onto private sectors such as pharmaceuticals, there are mechanisms within the United Nations that civil society, independent individuals can bring these concerns and these allegations of human rights violations or abuses, whether they've happened in the future or they are happening now. And through those official UN processes, we are able to investigate.
Tlaleng, in this memo that you wrote to the United Nations, you also ask that international financial institutions, I'm assuming that means the World Bank, the World Trade Organization, and Bretton Woods institutions, ensure that any grants and loans that they provide to developing countries contribute to expanding their capacity to procure. Now, the developing world is not known for very sound financial practices. In fact, South Africa, one of the countries with high levels of corruption that you'll see in countries like India, Nigeria, and most of the developing world. And there's a lot of wariness from Bretton Woods institutions and international financial institutions when it comes to loans, grants, and financial instruments that they make available to the developing world. Do you have the same concern that money will be pumped into these countries like South Africa and will disappear and eviscerate through corrupt practices?
Look, it's not just a concern. I mean, we have our own president in the country who's already spoken about, his concerns related to issues of corruption. We've seen an MEC in Gauteng who also lost his position as an MEC due to issues of allegations around, corruption and maladministration and misappropriation of funds. So this has only been something that we are thinking it could happen. We see continuously, even in the Latin Americas, also in the United States, about how citizens have been crying, about the lack of support and coordination and well thought out plans when it came to the issue of COVID-19, from the hard lockdowns to the different curfews and the different ways that governments have had to clamp down. And we understand the need. And again, when you're talking about, mechanisms guaranteeing fair access to this vaccine, it's very important, to talk about, the work that WHO has been doing, in leading the response. But also it's important that we have to look at the issues of impact of pricing, because pricing impacts availability, and lack of availability and lack of access actually has a direct impact on people's rights to accessing health and essential services. And so it's very important that when you're talking about pricing, it's not just about the exit price, but it's also the cost of production. And also in South Africa, we have to talk about the Medicines Regulation and Registration Council, about how often are they able to assist or hamper the development and the speed of development that needs to happen. But at the end of the day, it's only when we are doing coordination, global solidarity, that we will be able to, all of us as the population around the world, get through this pandemic, because we are not safe until all of us are safe. And so it's important that even those who are hoarding the vaccines, they realize that it's actually not going to, serve them in the future, because we need every person on this earth to have access, including, by the way, people who are in prisons, people who are institutionalized, women, children, people in the extremes of age, people with comorbidities. And again, we know that the existing discrimination, right, around LGBTIQA plus persons, around those persons who are homeless and using drugs. But we cannot allow COVID-19 vaccine to again be distributed within those prejudicial ways.
Dr. Tlaleng Mofokeng, thank you so much for your time. Really do appreciate it, and all the best, and have a fantastic holiday further.